Hello, everyone. Welcome to our OEH seminar for October 25th. It's my pleasure to welcome Ther, of which I probably didn't get that name quite right, but close. Ther is currently a PhD student at UBC. Previous to that, got a degree in occupational and environmental hygiene from Johns Hopkins back in Baltimore. So she got lucky location-wise just a couple of years ago, moved out here. Anyway, she's done a couple of 2 to 3 month visits to India and studied wood stove pollution. And I guess they've done an upgrade to some wood stoves in rural India, yes, which is probably helping with pollution, and Ther's going to tell us all about it. Over to you.
Okay, great. Thank you. So I'm going to be talking about a project that I've been involved with in rural India, and so I'll go straight into it. And so just to give you a background information about why this issue is important, and I'll go through the background really quickly because I got too excited with pictures and graphs. So, so basically, 2.7 billion people in the world use biomass for cooking. And majority of that population is located in developing parts of the world, in sub-Saharan Africa, in South Asia, Southeast Asia, and in Latin America. And most of that fuel is burned inefficiently in three-stone, or you call it open fire methods. So it emits a lot of smoke, as you can see from the pictures here. And most of the cooking is done by women and children, so the most exposed population are also women and children. And there are health impacts from these smoke that are emitted from the cook stoves. And the latest estimate shows that there's 3.5 million premature deaths that occur from the direct exposure to the smoke indoor, and 500,000 more occur when that smoke leaves the house and contributes to ambient air pollution. And some of the health impacts that it's been associated with are respiratory health outcomes, such as chronic obstructive pulmonary disease in women, and especially in women, but also in men, and acute lower respiratory infection or pneumonia in children, and also cardiovascular diseases. And other health outcomes are also includes tuberculosis and cataracts. And in terms of, this is a graph from the latest, most recent global burden of disease estimate. And it shows that in terms of morbidity, household air pollution, as you can see here, is the 4th highest risk factor in causing morbidity in the world. And here I highlight high blood pressure because studies have shown that household air pollution can increase blood pressure, which is a risk factor for cardiovascular disease. So it's a major health concern. Cause of health impact in the world. And these are just graphs to show you, able to visualize that the number of deaths per 1,000 capita per year that is attributable to household air pollution, and most from solid fuel use, and most of that again is seen in sub-Saharan Africa, Asia, and in Latin America. And again, this is morbidity data. It's very similar to the mortality because of the high prevalence of biomass burning for cooking in households. And in addition to health impacts, there are also climate impacts. The smoke that is emitted from these fires emit greenhouse gases such as CO2, methane, and nitrous oxide. And also, recent evidence has shown that there's also black carbon that's emitted from these smoke. And black carbon is essentially the dark component of particulate matter, particulate pollution. And because of its dark nature, it can easily absorb solar radiation in the atmosphere. And also, when it deposits on snow and glacier, it can speed up melting. And so there's, because of its direct and indirect impact on climate, it's now estimated to be the 2nd most important climate warming agent after carbon dioxide. And this is just a picture to quickly show you. The picture on the left graph, picture A, shows you these black carbon emissions and its absorption in the atmosphere. It's a satellite image of Asia, and shows you the darker colors are where there's a higher amount of absorption by black carbon. And if you look to the graph on the left, is a graph on the right, B, you'll see that once they remove the cooking source from it, the colors are much different, showing that biofuel combustion for cooking is a major contributor of black carbon emissions. In fact, in Asia and Africa, they say that 70% of black carbon emission comes from biomass fuel cooking. And in addition, there are also livelihood impacts because inefficient combustion of wood in open fire takes longer to cook and also consumes more fuel wood. And so, and in many parts of these developing countries, it's the women and children who are out collecting these fuel wood. And so it's a burden on their time and their energy. And also, if there are households that buy fuel wood, it's a big expenditure on their household income. So given these impacts on health, climate, and livelihood, there's been a renewed momentum for interventions. And I say renewed because Cookstove interventions have been happening since the 1970s and 80s. And most of that intervention was because of deforestation concerns, because it was believed that it was leading household use of biomass is contributing to deforestation. But later they realized that it was because of land use changes and agricultural practices. But in the past 2-3 decades, because of our increasing knowledge of air pollution and health impacts, and now more recently, the impact on climate, there's been a renewed momentum for intervention. And starting with things like the Global Alliance for Clean Cookstoves that was established under the UN Foundation. They plan to distribute 100 million cookstoves by 2020. And as well as national efforts, for example, in India, where they plan to distribute 150 million improved stoves in the next decade. And in addition to national and international efforts, there are also climate-funded projects because of this connection with the climate impact. So an example is the Clean Development Mechanism, which is a project that we're evaluating and that I'll be talking more about. And it's basically a climate market mechanisms that's established under the UN Framework Convention on Climate Change that allows investors or governments in developed countries to invest in projects in developing countries that reduce carbon emissions. So it's a funding mechanisms that could allow people to invest in improved stoves. So, but the issue with these renewed momentum is we still don't know what is an improved cookstove. There's a variety of technologies out there. And first starting with, we're starting from this open fire method that's prevalent in many parts of the world. And as you go up, there's rocket stoves that provides an insulated combustion chamber. And it goes up, it provides a chimney. And then there are fans that you need battery power, electricity, to generate higher combustion efficiency to different fuel use, such as gas and electricity. So most of the interventions that are happening in developing countries are in this, this is not working very well, in this area of rocket stoves and fan stoves, because they still use the same fuel that is locally available, whereas it's not practical to try to bring gas and electricity to a rural remote village. So most of the interventions happening there, but there's been very limited field evaluations to really assess what is their effectiveness in the field. And also in general, it's not really a linear function like this, but in general, as you go up to higher efficiency stoves, there's also cost associated with it. And so this is affordability is a major concern when we're trying to do an intervention in rural remote areas. So, and also another issue with trying to do these interventions in the world is that there's been very limited field evaluations actually done. And a few that we can just count. One major one is in Guatemala that's been done. It's a randomized controlled trial. And they've shown major reductions in air pollution, but the health outcomes have been somewhat sort of not very strong in terms of, physician diagnosed pneumonia in children haven't really decreased, statistically significantly reduced. But in other symptoms, they have reduced. So it's somewhat mixed. And a study in India is also another randomized controlled trial that studied intervention over a 4-year period. And it shows that the emissions indoor concentrations were reduced in the first year, but then as they studied follow-up for another 3 years, the reductions weren't significant anymore. And in fact, the health impacts there were no health benefits seen. So it's really important to really study how these interventions are having an effect in the real world. And there are also other studies that are increasing because of this renewed momentum, such as in Honduras and other parts of the world, but they're mostly cross-sectional in nature. So the study that I'm going to talk about is the India stove changeout program. And it's implemented, the stove changeout is implemented by this NGO called Samuha. And they plan to distribute improved biomass cook stoves in 110 villages in Karnataka state, which is in the south of India. And it's a project that's been approved under the Clean Development Mechanism, which is the climate financing mechanism that I mentioned earlier. And they plan to reduce greenhouse gas emissions. So basically going from this mud wall stove to these improved stoves that are insulated and closed combustion chambers. And so it's so we formed a collaborative partnership. So basically, this is to show you that this is the NGO that plans to disseminate these stoves in 110 villages. And prior to that, they plan a pilot intervention in a village. And this is where we come in with another local NGO, as well as 3 universities from North America. And we formed a collaborative partnership to study what is the effect of the intervention. And so the NGOs provided us with the technical and field staff, and we provided the equipment data analysis and technical expertise. And this is basically to show you that this is an intervention that would have gone ahead and happened anyway, regardless of whether we evaluate or not. So the purpose of this evaluation, again, is to independently evaluate this intervention, and also because there are many candidate stove technologies out there, but they are unproven in the field. And also we would like to inform policymakers, because there are potential co-benefits with health, climate, and development, how can we maximize them? Because this is a climate intervention, but we want to be able to have health benefits as well. So the intervention that we are studying is called Chulika. That's the name of the improved biomass cook stove. And it's a rocket stove design. Basically, it's just an elbow-shaped combustion chamber, and it's insulated. It's very basic. It's locally made in Bangalore, which is capital of that state, so it's not very far from there. And villagers pay $5 to participate in the CDM stove exchange program. And lab-based measurements of this stove show that it has 3 times increased thermal efficiency compared to the open fire stoves that they're using, and also it saves wood. But that's in the lab, so we want to study what actually happens in the field. So just a background information on this area, study region where we're working. So as you can see, there's a small map of India, and we're in the Karnataka state, which is in the south. And then within the state, we are working in the northern part of the state called Koppal. And as you can see, Bangalore is down here, so that's where the stoves are manufactured and transported to this area. So if you look at the statistics for the number of people who use biomass in this part of the state, is 90% use biomass fuel for cooking, and almost all of them cook with the open fire or 3-stone fire, and then 90% of them of cooking is done indoors. So there's expected to be a high amount of indoor air pollutions, and also most of the population in this district are rural and poor. Living on less than $1 per capita per day, and also majority of them are agricultural laborers or daily wage laborers. So the research question that we're interested in is, does moving from traditional biomass stove to improved cook stove, does it have an impact on indoor air concentrations, cardiovascular health and eye health symptoms, and also what is the impact on outdoor air quality, as well as the emissions, which is important from a climate perspective. And then what is its impact on time use, time that women spent cooking, collecting fuel wood, and cutting wood. But for my thesis, I will be concentrating, the circles got shifted. So I'll be concentrating on A, B, and E. So you just shift the circles down. And so that's the results that I'll be presenting today. So the methods, we designed a randomized controlled trial to study the effect of the intervention. And we conducted surveys to collect information on household assets, demographics, and self-reported time use, and also did indoor and outdoor air pollution measurements. So as you can see from the picture on the top, that's our field team doing the surveys. And in the middle is our air pollution equipment that's measuring in the kitchen area where the woman is cooking. And then this is the shed where we had an outdoor air monitor. There's a weather station up here, and then a little cup there, you can see that's collecting the air, like the close-up. This is the close-up version here. And also we measured the blood pressure of non-pregnant females above the age of 25 years old and collected their height, weight, waist circumference, and also their salt, so things that can influence blood pressure outcomes, as well as their medical conditions, any medicine they may be taking. And also we weighed fuel wood before and after a 24-hour period. So the pictures again are showing the blood pressure outcomes, blood pressure measurements, and the fuel wood weighing by our field team. So this is the bird's eye view of the village, and you'll see there are a couple of temples. We did our outdoor measurements, not exactly in the center of the village, but a little up north because we couldn't find a shed that we could rent. But basically, we try to capture the village level concentrations. And also we put in an air monitor about 2 kilometers upwind of the village to measure background levels, so somewhere down here. So I'll be presenting a little bit of that. So the results. So our randomized controlled trial study design looks like this. I won't go into the details of it, but this is just to show you we started with 300 households in the village, and ultimately 187 were eligible for our study. And we separated them into control and intervention group, where we did baseline measurements. And that was done in the fall of 2011. And then after the baseline measurements were done, we introduced the intervention into the intervention group here. And then 2 to 6 months later, we did follow-up measurements in the spring of 2012. So I call this season 1 and season 2, which will come up in the graphs, results that I show later. So, and this is the characteristics comparing the control and intervention group. I don't want you to concentrate too much on the details. This is just to show you that if you look at the p-values testing the difference between control and intervention group, there was no significant difference, meaning randomization was successful, and that there are similar characteristics between the 2 groups. And similarly, almost similarly with female participants, where we measure the blood pressure outcome, is that almost all of them were similar between control and intervention group, except for BMI. There was a significant higher increase in the intervention group, so we would have to control for that later in our analysis. So in terms of the intervention adoption, there were some issues. So when we collected surveys on whether the women were actually using the stoves or not, what we found was that only 60% of the households were using the improved stoves. And where over a third of them was using it in combination with they went back to the traditional stoves, or used it in combination with the traditional stoves and the new stoves. So as you'll see the picture on the upper right, this is the woman using 2 new stoves as the intervention intended. But in the middle, you'll see that one of the new stoves has been pushed to the back, and a 3-stove fire put in. And in the last picture, you'll see that they've even rebuilt the original stove into the cement or into the mud there. So there's a variety of ways in which people are adopting this intervention, and we will have to look into that in our analysis as well. So one of the main reasons for why people have not adopted both new stove is because for the majority of them, it's difficult to make the rotis, which is the traditional Indian bread. And because the fire is more intense and concentrated in the middle, the rotis are getting burned. So, so people brought it back the traditional stove because of that. And then there were also other smaller issues with poor quality and need to cut wood into smaller pieces, as well as food tasting different and sort of like cultural aspects as well. So this is what we found. And so now I'll present the results of the air pollutants. So this is a comparison just to show you of indoor and outdoor air pollution. And you can see on the graph here, this is showing you the PM 2.5 concentration by location. So the first box is the indoor, and in the middle is in the center of the village, and then upwind of the village. And you can see a huge difference between PM 2.5 concentrations between these 3 locations. And there's the indoor concentrations are significantly higher than what is recommended by the WHO 24-hour guideline. And also this is just to help you visualize the filters that we weighed, that we looked at, which any saw. So upwind of the village is fairly white, so it's almost like an unused filter. And then the village center, it gets a little darker. Indoor medium concentrations were brown, and then you can see the indoor, where the concentration is like 1,000 microgram per cubic meter of air. It's completely black. So this is the type of air pollution concentrations that most of the women and children are exposed to in these parts of the world. So now we will look at the change in indoor air pollutant concentrations. That is looking at the difference between season 1 and season 2. So if we look at the graph on your left side, looking at just PM 2.5 concentration, the change, and by looking at the control and intervention groups, you'll see that this is showing you, if you see the 0 there, so if you see that the majority of the concentrations were above the 0, which means that in season 2 there was a higher increase in concentrations in both groups. But the change for the difference in change between the control and intervention group, there was a slightly marginal significant difference between the two, meaning that there was a lower increase in the intervention group. So they both increased, but the increase in the intervention group was lower than the increase in the control group. Now, if you look at the graph on the right, it's looking at black carbon. It's very similar in a sense that there was an increase in both groups as well in season 2, and there's the level of increase was similar between the two groups. So now to make it a little more confusing, I'll divide this intervention group into stove use, because we want to see, what is the efficacy of this technology. And again, we see very similar results in that if we look at the change in PM 2.5 concentrations with the graph on the left, and by looking at 3 groups, so we have the control group, people using traditional stoves, and the 2 chulikas are people who solely only use the 2 improved stoves, and then the mixed stove users. And you'll see that, again, there was a seasonal increase, but the increase in the 2 chulika homes was marginally significantly lower than the control group. For black carbon, all of them were similar in their increase between the 3 groups. So combining these 2 pollutants, we want to look at the ratio of black carbon to PM 2.5 concentrations. And the reason we want to do that is because one, black carbon is a component of particulate matter, so we want to look at proportionally how does it vary, and also because some of the rocket stoves, improved biomass cook stoves, have shown that in the laboratory they increase black carbon emissions. So we wanted to see how that it's really playing out in the field. So this graph, if you look at the y-axis, it's showing the ratio of black carbon as measured by absorbance over PM 2.5 concentrations by the stove use. And then in each group, you'll see season 1 and season 2. So generally across the 3 groups, you'll see there's a seasonal increase in the ratio, but the increase was only significant in households that use the new stoves. So this has implications for climate as well as health. So in terms of health outcomes, we are again looking at now just intent to treat analysis, so with the original designation of control and intervention group to test the effectiveness of the intervention. And again, if you look at the graph on the left, it's looking at systolic blood pressure, and the y-axis looking at change in blood pressure. And you'll see that there's no significant difference between the 2 groups. And as well as in diastolic blood pressure, there's no significant difference between the 2 groups. Now again, following a similar trend, I wanted to divide it and look into the change in blood pressure by stove type use, as well as by age groups, because there are some studies showing that air pollution has a different effect on different age groups. And so in the graph on the left is looking at the young age group, so between the ages of 25 and 50. And if you look at it, and by stove use, there's no difference between the three groups. But if you look at the older age group that's above 50 years old, there is a statistical significant increase in households that are using a mixture of these stoves. And similarly, that was systolic blood pressure. So now we're looking at diastolic blood pressure. Again, in the younger age group, there's no difference between the stove types. But and also in the older age group, there's no statistical significant difference. But you can sort of see an upward trend as you get to stoves that are using a mixture of both traditional and improved stoves. So this is a graph that's showing you the percentage of women that's reporting eye health symptoms. And the reason we measured this is because we were working with the NGO, and some of the villagers was concerned about their eye health symptoms. And they said, our eyes burn from the smoke. And so we're interested in this new technology because we want to reduce the symptoms. So it's something that's important to our participants. It's one of the reasons why we did the self-reporting measurement. And so it shows that basically in both groups, all three groups, there was a reduction in the post-intervention period in eye health symptoms, self-reported eye health symptoms. But the reduction was only significant in households that are using 2 new stoves. And there are two potential reasons for this. One is that it could just be because the participants are not blinded. They know that they've adopted these new stoves and they're expecting health benefits, that it could be a self-perception issue, or that another potential is that there may be change in the smoke composition that we're not measuring that may lead to this significant reduction. So now in terms of fuel wood and time use, because we want to study the livelihood impacts, basically this is showing the change in fuel wood use between the 3 types of stove users. And again, the medium of these box plots are below 0, so meaning there's a general reduction in the second season, but they're not significantly different between each other. So there's no significant reduction in fuel wood use, whether they adopted the stoves or not. And same thing with time use. We collected on how much time they spend collecting fuel wood, cutting wood, and cooking. And it shows that there's no reduction in these 3 groups, in these 2 control and intervention groups. And also what I found from the surveys was that there was a lot of variation in time. For example, women would spend 12 hours collecting fuel wood, and I would be wondering why would they spend half a day doing that. And so, so last summer I went to India and got a chance to talk to the women, and followed a few of them as they went out to collect fuel wood. And what I learned was that for most of them, they were collecting fuel wood as they went out to do their farm work. So it was combined with their farm work hours. And so we were getting a variety of answers, responses that made it hard to do an analysis based on self-reported time. So these are just some pictures to entertain you. So this is a woman that went out to do farm work, and I sort of got her permission to just tag along. And so she was doing her farm work, and during her break time, she crossed over to a few farms over and started collecting twigs and so forth to carry it back home. And this load is very heavy. I think I'm quite strong, but I couldn't lift it up much above my waist height. And they just do it so effortlessly and put it on their head and walk 1 to 2 kilometers back home. And this is a woman who made just a separate trip, not included, combined with her farm work, and she just walked over to a public land, and she collected fuel wood and also walked back home. And it's okay, it's allowed because she's not cutting the fresh wood, she's collecting dry twigs that have fallen on the floor, on the ground, so this is allowed on the government land. And in this case, for the men, some of the men in the household that have carts, they actually go on an overnight trip and collect a huge load of fuel wood and bring it back. And in that case, they may be spending 24, 48 hours. They will be reporting 2 days, 3 days in their fuel collection time. So that made the analysis kind of challenging. And this is sort of me holding a GPS and following the women around and from their village as they go about to their farm work or to the public land. So in general, they walk, 1 to 2.5 kilometers with that heavy load on their head to bring back the fuel wood. So in summary, is that there's a low and poor adoption of this intervention. And it's also interesting to note that because this is a pilot village, they were monitoring once a day. Their NGO staff came into the village once a day to make sure the stoves were fitting people's needs or if they had any issues. When the actual CDM project rolls out to over 110 villages, the requirement is only once a week. So there may be more compliance issues. And then what we found also is that Chulika stoves, these improved biomass cookstoves, were not effective in reducing PM 2.5 or black carbon, blood pressure, fuel wood use, and time use. So they're not effective. But what we did see was there was a significant increase in the proportion of black carbon to PM 2.5 ratio in homes that used the new stoves. So what we want to say is that rigorous field testing of these interventions are limited, but they're necessary to assess the actual health and climate benefits. And so the next steps that I'd like to do is to do a mixed effect model for blood pressure and air pollutants to see relationships between the two. And also next summer or next spring, I hope to be able to go back to the field, to the same village, to probe further into livelihood impacts and their time use because of the variability of responses that I got. And I hope to be able to use both qualitative and quantitative methods. I interview focus group discussions with the women, and as well as do a participant observation and GPS tools to do quantitative measurements of how this intervention would have affected women's livelihood. And also I have to start thinking about, well, I thought about it, but I have to actually actualize this is the knowledge translation to community partners. So I would like to thank the collaborators of this project, and it's from several partners we have, and it's University of Minnesota, Julian Marshall. I think he was a Bridge person as well, Bridge Fellow, and he's the PI of the study, and Jill, Bruce, Ram, and as well as from here at UBC, Connor Reynolds was also a Bridge Fellow, and Andy Grishop, and the directors of Samuha, who opened their doors to us and gave us an office and access to the village for us to work with. And as well as another local NGO who provided us with the technical staff. And also I'd like to give my thanks to the Karnataka field team and the villagers who opened their homes to us. And my thesis supervisor, Dr. Michael Brower, and my committee members, Julian and Hisham. And the funding came from University of Minnesota at Institute on the Environment, as well as my Bridge Fellowship. So thank you, and I can take questions.
Great. Okay. So yes, hopefully everybody here knows if you've got a question, put up your hand. We'll bring you the microphone, and we'll listen to your questions. There should be a bunch. This is a very interesting talk. Seeing no hands up, I guess I'll ask one myself. So, have there been studies done of other types of stoves, similar studies to what you've done, to see what their effectiveness is?
Yeah. So I think I can.
Sorry, you're wired.
So the study in Guatemala was looking at a rocket stove style in terms of just a more insulated combustion chamber, but it has a chimney on top. And so they did see a significant reduction in air pollution, but not all the health outcomes were significant. And so there are studies, an increasing number of studies that are looking at different technologies. But I'm not sure if they've actually studied, done a randomized control trial, a rigorous field evaluation of higher technologies like the fan stoves and the gasifier stoves. I'm not so sure about that.
Here.
So really neat work. Given that this has policy implication, What, in the end of the day, if the stove isn't all that good and doesn't change anything, what is your recommendation into policy around it?
We definitely need better stoves, but also there are issues of affordability, and that's where people are hoping to leverage things like the climate financing programs to be able to increase affordability of higher technology stoves. But there are methodology concerns with these climate finance mechanisms as well, because at this moment, the CDM project that we looked at here is only considering the fuel wood use and not the other health outcomes and things like that. So I guess we're at sort of an exploration discovery stage of what's the best way it would work, and we still don't have any certification about what isn't considered an improved stove either, even though we know that we need to have higher technologies. And also, some of the studies have shown an exposure response curve. It's not linear. In fact, the health response is much higher in the initial concentrations than in the higher concentrations, which means that the reductions have to be reduced significantly to see a health benefit. So, which means we really need a much more efficient stove. And also, another lesson is that most of the interventions happen based on laboratory results analysis, and which is quite different from what we actually see in the field, because there's behavioral differences that we don't take into consideration, and also wood type, wood moisture that affects the combustion efficiency. So I think one of the major lessons for policy perhaps is to do more rigorous field evaluations of these technologies in the field.
So your study showed an increase in the ratio of black carbon to PM 2.5 with your stoves. So what I'm wondering is that really a beneficial thing? Or
no,
yeah,
it's not. Yeah, that's the thing, is that this is a project that's financed under the climate mechanism, which only considers fuel wood and so CO2. But most of the climate funding mechanisms to this moment, there are a couple of them, such as the gold standard and other climate funding mechanisms, and none of them are considering black carbon. And now we are seeing that black carbon is actually quite an important climate warming agent. So another thing I think in the future is to start to incorporate this pollutant into these interventions, consideration of this pollutant.
Were you a little surprised by the black carbon results in the improved stoves, and also what do you think about the willingness of the participants to adopt some health protective measures in the interim until it can be more sorted out whether or not the improved efficiency of burning stoves are better for the health or not?
Was I surprised? Well, I guess I went into it not really knowing much about this technology and its efficiency, emissions, and so forth. But as I was in my second year of school, one of the other students at UBC in my department did laboratory measurements here with the stove that we're using, and he did find that there was a higher emission of black carbon. So this sort of field study supports that this technology is not very efficient in reducing. And also, in general, though, I have heard that rocket stoves, which is the model that's used here, have emitted higher black carbon emissions. And it's not the fault of this technology in a sense that these weren't made to reduce BC. It was they were meant to reduce fuel wood use. But I think in the future, because of this increased awareness, people may be doing certain things, upgrading the technology to decrease BC. And your second question about the women, what do the women think about, the participants think about this intervention? I think that's a very big question globally, because we want to be able to improve health and livelihoods and so forth, but sometimes it doesn't really, that's sort of the priorities in the communities are sometimes different. Some studies have shown that participants, their main concern is fuel wood use rather than health concerns, or even climate. Why should they care about climate warming, global warming, climate change, and so forth? And so it's definitely, I think, a big picture thing that we need to figure out. I'm not sure that's the best answer. Mike, you might have a better answer.
I think the important thing about all this is that, as Ther said initially, there's lots of emphasis and lots of money put into interventions now, and fundamentally people don't know, first of all, what works, and secondly, actually, they don't really know a lot about what's going to be acceptable in terms of the user. So it's great to sort of say this technology is wonderful and maybe even it's cost effective, but then it's a whole other story, as you can see from this study, to see that it's actually going to work, to first of all work in the real setting, and secondly to be acceptable. And really it means that you have to do these kinds of studies, and you probably have to do these kinds of studies all over the world, because a stove that may work in this setting probably is not going to work in sub-Saharan Africa, or may work, vice versa. So I think that's the answer.
Yes, just I guess, yeah, from my listening to your presentation, there's a number of issues that still need to be studied, like how to make these things cook as well as or better than the existing technology they're using. Because a cook stove that burns your food all the time isn't going to be widely adopted. The other thing I'm wondering is if people done studies where they check the moisture content of the fuel being used and looked at the impact of dry fuel as opposed to damp or wet fuel on emissions and cooking quality, these sorts of things.
Yes, there's definitely in laboratory measurements have done wood moisture content analysis and the emissions, and higher the moisture content, the higher the emissions. And in our study, we did measure that as well, and Andy Grishop from North Carolina State University is doing that analysis. He's doing the emission measurements as well as the wood moisture content. So
you will have a picture of how wet the wood was that was being used in these different homes during your study.
Mm-hmm.
Excellent. And hopefully that, yes, I mean, I burn wood myself, and I've been aware for a long time that getting it really dry makes it burn better and reduces the creosote in your combustion system, all these sorts of things. But I understand there's a lot of people try to burn wet wood, and
yes.
With very different results.
Right.
So it's, I guess in some places that would be an education thing. It'd be interesting to know what would be involved in reducing the average moisture content of wood being burned in the village, like you were studying. Lots of opportunities. Yes.
Hi, thank you for your presentation. Given that the NGO's main focus is to reduce the fuel wood consumption, and you're seeing that there's no reduction, do you think that there's a point in rolling it out to the 110 villages, or should they consider waiting for a better wood stove?
The NGO is definitely going through a learning process. So, for example, even things like when the stove broke down, some of the stoves broke down, or when women were having problems with the burned rotis, they introduced different plates where the heat can be distributed rather than sort of a more concave plate. And also they feed that information back to the manufacturer in Bangalore to tell them, look, the combustion chambers are falling apart. We need different materials and so forth. So there's a learning process and improvement process. So even when we were doing the study, the laboratory measurements showed a 30% increase of this model. And then as we were conducting in the middle of our study, they were able to increase by changing the material of the stove to increase it to 40% thermal efficiency. But we asked them not to introduce that because then that would introduce too many variables into our study. So I know they're trying to improve on this technology, but I don't know where they are now at the moment. But definitely, I think it will form a part of our knowledge translation when we communicate back to them. So I don't know what their next future plan for going 110 villages at the moment.
So I guess one of the benefits of your research will be that hopefully the product that's rolled out to these 110 villages will be better than what you started with in your study. But how much better is something that would need to continue to study, right?
To see health, how much better does it need to be to see health benefits and other benefits? Right.
Yes. I guess something else engineers have understood for a long time is that venting your combustion product outside is way better than releasing them inside your home. A lesson that needs to, well, I mean, if we're going to have health benefits, to me, that's really a key step, right, is to have chimneys connected to these cook stoves.
Yes, that definitely reduces indoor concentrations, but also what we see from the global burden of disease is that it goes outdoor and contributes to outdoor air pollution, and that also leads to health impacts from that. You'll see, the concentrations in the middle of the village and the background village. So I think our ultimate goal should be to just be able to introduce stoves that are quite highly efficient rather than sort of just venting it outdoor. Because there's also the climate impacts as well as health.
Yes, but given that your indoor concentrations are so much higher than the outdoor concentrations, your impacts just from taking those emissions outdoors, your health impacts, I think, are going to be pretty substantial. Obviously, reducing the amount that goes outdoors will also be good. But using the people indoors to absorb the pollutants to protect the outdoors doesn't really work for me. Anyway, other questions? Oh, you've got an online question.
Hi, there is a question from online audience. So, are there any difference in PM 2.5 or black carbon concentrations between closing window doors and open window doors while cooking?
Most of these houses, and I wish I could take a good picture of the houses inside, but it's really difficult because there's very little window. Actually, their window would be just about this much size, and it's just in one corner. So it's really dark also, so it's hard to take pictures even during daytime. So, it's not that they're opening windows during cooking. There's nothing to open. It's just a hole in the wall. So we did when we were doing the measurements, we did write down like other windows and other things, but there's not much variation.
How about the doors, though?
Yes. Again, there's often in many of these houses there's one door that goes into the kitchen, and it's oftentimes there's no door. There's no door. Yeah, there's an opening, and there's no door.
Canadian kids would really like that because nobody's ever going to yell at them, close the door. Don't have it closed.
Mike had a question.
I'm not going to ask you any questions, but just a comment again towards, on Ed's point about the ventilation. I mean, it's really important to remember that the impetus and the funding for most of these projects actually is focused on climate. It's actually not focused on health. And so so for many years, actually, health has been an afterthought. So the ventilation side of it, even though, so the Guatemala study, for example, that Ther mentioned, that was the primary intervention, was a chimney. So yes, they are somewhat effective, although the smoke does come back inside, and what your neighbor is emitting comes back into your house. But I think there's generally a realization in this field now, and there was participate in the World Health Organization guidelines for household cooking that are just about to come out, and really that's saying that you need to be going towards what we all have, which is gas or electricity. So why should we actually be expecting somebody else in another part of the world to be using something that we would never allow in our homes? And anything in between is really just an interim solution. And that may be a very tough pill to swallow. And we do need to get sort of better interim solutions. But really, ultimately, I think the whole idea of sort of improved stoves has been a complete failure. And there's been lots of money spent and lots of NGOs have put lots of time and effort into these, and really very little evidence that they actually do what they're supposed to do. So that's what I think the realization is.
And no, I agree. No, I was just gonna say that I just read online that the sale of carbon credits from cookstoves quadrupled in 2012. So just to show you, to add to the point of Mike, making that there's a lot of money in this going in, especially now the European trading scheme is going to allow this trading of carbon credits. There's been more buying of carbon credits from cookstove intervention. So I think things we need to watch out for.
Here is another online question. Given that the automobile use in Western country where the majority of the emissions are coming from, how efficient a use of funds is this type of the intervention when compared to the transit prevention in Western country? For example, like do we need to be hassling push people to use less wood or just driving less in the West?
So it's for solutions in Western countries, developed countries. I guess also it would depend on where in Western countries. For example, maybe in the northern parts of Canada where wood burning is quite prevalent, there may be more benefits from upgrading their technologies, wood burning technologies, to reduce emissions, or getting certified stoves that actually reduce emissions. And also, I noticed that in Europe, that because of the economic crisis, that a lot of people, for example, in Greece and Italy, are going back to biomass burning in their homes, and it's contributing to a lot of ambient air pollution there as well in the recent past year or two. So it depends first of all, what part of the Western world, and I guess there's benefits to be had from both. Upgrading to technology for both fields.
Hi, great presentation. So I'm not sure about southern India, but in northern India, I know that when they farm and it's time to change the crop to like sugarcane or whatever, they set the entire field on fire. And I've been there, and it's not pleasant because you're just coughing and the smoke just gets to you. So I'm not sure if they do that in southern India, but if they do, I'm pretty sure the smoke gets into the houses because it's an open house, it's not a closed house. So how did you account for that coming into effect compared to the stove smoke?
Yes, we did ask about that in the region where we studied to make sure that there wasn't other sources. And during I think in general they don't burn the field. And in the study period that we were looking at, the time period, there wasn't any burning nearby of the agriculture farms. But we were cognizant of that and did ask.
And I guess, yeah, just to counter Mike's point, I do believe that the more efficient wood stoves and such that the EPA has mandated in North America, in my own observations, they make a visible difference in emissions. Once my little wood stove gets hot, which takes 20 minutes or so, there's no visible emission of smoke out the stack, which is way better than my other wood burning appliance. So yeah, they can make a difference. I think drying fuel makes a big difference in biomass emissions. And I think people will continue using biomass, like a lot of people are using it in Campbell River, where I was last week, because it's cheaper than gas or electricity. And yeah, LPG or electricity might be more desirable, but how many people are going to afford it in the next 20 years?
Right. Yeah.
Yeah. Questions from anywhere? Time to thank our speaker for a very thought-provoking presentation and some good research.
Thank you.